Good evening, everyone. My name's Dr. Michelle Morse, and I'd like to welcome you to the Clinicians Roundtable. We are really honored that so many of you were able to join and answer the Commissioner's call. We'd like to start by sharing some opening remarks from Deputy Mayor Melanie Hartzog. And just before I pass it over to the Deputy Mayor, I wanted to just share a grounding quote to get us in the mindset that brings us back to the origins of our professions, I should say. I just think it's a really important moment to be able to do that. So this quote actually uses the term medicine, but I'm going to replace it with healer. Wherever the art of healing is loved, there is also a love of humanity. And we're really excited to be able to be in conversation with all of you as providers, clinicians, healers, and really prepare ourselves for this next phase of the pandemic and our vaccination campaign. So with that, I'd like to introduce Deputy Mayor Melanie Hartzog. She is New York City's Deputy Mayor for Health and Human Services. In this role, she's responsible for guiding the city's response to the ongoing COVID pandemic, and she oversees the social services agencies that deliver care and assistance to New York's vulnerable populations, including seniors, the homeless, children, and victims of domestic violence. Deputy Mayor Hartzog also guides implementation of New York City Health and Hospital strategic goals and sits on its board. Thank you, Deputy Mayor Hartzog, for being with us.
Thank you for having me. I'm happy to be here. And I'll keep my remarks. I'm always very brief, but I want to just thank all of our panelists, especially all of our FQHCs for the hard work they're doing in communities. I think on a daily basis, I talk with our commissioner, and we're constantly looking at where we are with our vaccination rates. And the FQHCs have played a tremendous role in being trusted partners, trusted voices in communities. And I can't thank you enough for all the hard work that you're doing. And I will just say on this topic of vaccination and my own personal journey with it, I think for me, it was, an obvious decision to make. I work with a wonderful group of doctors, including the commissioner and Mitchell Katz, and Ted Long, and Jay Varma, who are all experts in their own way. But I will say from a very personal perspective, the decision to get vaccinated from my family, a family of immigrants, especially my mother and my grandmother, who I'm very, very close to, was very hard for them. And even though they see their daughter all the time and all of these wonderful doctors on TV, and I said to them personally, are you ready to get vaccinated when it was their turn? The first thing they both said is, I need to talk to my doctor. After everything that their daughter does in her career and profession, for all the times that they tell me about the wonderful information they hear from the doctors, they had to speak to their own doctors that they trusted. And I gave them that opportunity to do that and said, okay, we'll have another conversation again. But it really was a journey for them and a constant conversation to have. Thankfully, they're both fully vaccinated and made that decision. But, I listened to the commissioner and met them where they were at and was patient with them around their decisions and, very thankfully got them vaccinated. That's all to say, I know we have a long, long way to go in really leveraging all of our trusted partners in the community and getting them to a place where they're ready to make their own decisions around getting the vaccines. So I'm just happy to be here, happy to learn from all of you, and also here to support in whatever way that I possibly can and bring to bear the resources of the city and the mayor to help all of us. So thank you.
Thank you so much, Deputy Mayor. We really appreciate your support and your leadership during this time of crisis that we all hope to see the other side of and emerge from in the coming weeks to months. Next, I'd like to introduce Dr. Dave Chokshi, the Commissioner of New York City's Department of Health and Mental Hygiene. As the city's doctor, Dr. Chokshi leads the health department with the values of science, equity, and compassion as the health department works to carry out its mission to protect and promote the health of all New Yorkers. He's also taken care of patients as a primary care physician at Bellevue Hospital and previously served as Chief Population Health Officer at New York City Health and Hospitals. Over to you, Commissioner.
Thank you so much. And first, let me just say I'm so happy to be here today with Deputy Mayor Hartzog and my health department colleague, Dr. Michelle Morse. whom we haven't introduced yet as our very first Chief Medical Officer, as well as Deputy Commissioner for the Center for Health Equity and Community Wellness. And what I'm truly thrilled about is being here with all of you in this virtual setting. The nurses, the doctors, the therapists, the pharmacists, the doulas, midwives, social workers, that span of clinicians and healers who serve the health needs of New Yorkers. And I must say with particular courage and endurance during this devastating pandemic. And at the risk of opening up a logistical can of worms, I just have to say that this coming together feels great. It's something that we, as a broad slice of the city's health practitioners, should do more often, particularly marshaling a unified response during what feel like these all hands on deck moments. But we'll take one thing at a time. And right now, that one thing couldn't be more critical. It's about COVID vaccination. And my bottom line is that this is about as straightforward as it gets in some ways. Getting vaccinated is the single most effective way that our patients can protect themselves and their loved ones against COVID-19. And community immunity is the single most effective way to put the tragedy of the pandemic behind us. Right now, we are, as I'm sure you know, at a pivotal turning point. We've made tremendous progress in our COVID vaccination campaign. Over 6.4 million doses administered, and 53% of New York City adults who've gotten at least one dose. But we also know, what we say in public health often is that the last mile is often the hardest. And so now our collective job is to build vaccine confidence. But stay with me on this. My take is that building confidence actually starts with humility. I think about, as the deputy mayor said, the conversations that I've had with my family members, with my patients about COVID-19 vaccines, but also about other medical interventions. And, if you're anything like me, it's certainly humbling to think about all the times that I have struggled to persuade them of a recommended test or treatment. But humility is actually what has given me the strength to accompany them in their struggle with care and compassion. I remember a particular patient of mine whom I gradually helped quit smoking over 7 years of taking care of her, only to have her start back up again when her brother died, tragically. That was understandable, of course, just as people's reasons for deferring vaccination may be understandable as well. But we have to bring this same spirit of iteration, of listening with empathy and persistence. Those are the key elements of what we need in our vaccine confidence efforts right now. Now, you may hear people speak of vaccine hesitancy. My take is that we should consider hesitancy what we call in medicine a diagnosis of exclusion. That means we have to cross everything else off of our list before we chalk up someone's decision to hesitancy. So have we lowered our access barriers as much as possible? Have we answered their questions? Have we reflected on their prior interactions with healthcare and how that may color their values and preferences? And for us, particularly as clinicians, have we made our strong recommendation to get vaccinated and shared our own story? I think we should build vaccine confidence with confidence because, to put it simply, the vaccines work and they are saving lives. So we owe our patients both that empathetic ear, but also that strong recommendation. My suggestion is that we have to make it as routine as checking one's temperature or taking our patient's blood pressure. I want to make it so that it becomes a reflex. We think about it every time you're washing your hands before a clinical encounter. And we have to also pass along the stories of vaccine success, the personal breakthroughs you've encountered, the tears of joy that you've witnessed, the grandparents who are able to hug their grandchildren again. We have to make it so that those stories are spreading faster than the virus and do it again and again until we don't have to do it anymore. You have my commitment that our city team will do our part, and you'll hear more about how we're planning to support you from Dr. Morse. We'll be even more focused on our equity goals, particularly around race and place in the weeks ahead. But for tonight, I want to end by saying we're here to listen and to learn from you as well, and to figure out how we can better partner together on our urgent mission. So thank you so much for joining us, and I look forward to the rest of the conversation.
Thank you so much, Commissioner. Really inspiring words. I know that the providers who are listening in, again, whether you're a pharmacist, a nurse practitioner, a social worker, psychiatrists, doctors, healers of all flavors, we just really, again, appreciate the opportunity to be in dialogue with you. And I just want to start my brief remarks by introducing myself formally. My name is Dr. Michelle Morse. I'm the first ever Chief Medical Officer for the Health Department here in New York City, and I'm also the Deputy Commissioner for the Center for Health Equity and Community Wellness. I'm really honored to get to share a few more opening comments, and then we're going to have a bit of a panel discussion with the clinicians that you see here, talking about their experiences, speaking with patients about the vaccine, their experiences making the recommendation to get vaccinated, what works, what the challenges have been, and how we as a community of clinicians and healers can support each other in having these conversations and make sure, again, as the commissioner said, that we have the tools we need to have this conversation with the patients and the communities we care for. I want to start just by acknowledging and recognizing the sacrifices that clinicians and healers have made over the past 16 months in this pandemic. This is obviously a time of incredible challenge, disruption, and change, and unfortunately also a time of loss. And I have to also make sure I acknowledge and shout out our brothers and sisters in Brazil and India who are experiencing an incredibly profound and difficult time right now, perhaps not dissimilar from New York City 16 months ago. And I also think it's really important that we recognize that as difficult as these past 16 months have been, we're in a phase where we have some solutions. And it's really important that we use those solutions like the vaccine as much as we possibly can and make them as accessible, available, and used as possible. It's important, I think, to recognize that what we know about folks who have decided who have not yet decided to get the vaccine is that some of the things that are top of mind are the health concerns, like the side effects, or not having enough information about if the vaccines work or not, or issues about access to the vaccines. And these are all incredibly important issues that we as clinicians and healers have to hear, have to not just hear, but actually act upon, and really do so with empathy and with compassion, really getting at the heart of our profession, the healing professions, and not making this about a judgment or forcing anyone into a decision that they're not prepared to make. And so that is, in my opinion, the heart of the art of healing, as it's called. And it's something that we, I think, are called together to both do and to lift up as much as possible. We also know, and what we're hearing from patients and communities, is that healthcare providers are the most trusted source of information about the vaccines. And we're in a phase where many folks have decided to get vaccinated and have already put it in the rear view, but there are lots more folks out there who have not yet decided. So what is our role? What is our call to action as clinicians and healers in this phase of the pandemic and our vaccination campaign? I want to also lift up recent information that just came out from the Centers for Disease Control that really help us to see that the vaccines are effective, right? That for vaccinated adults who were over the age of 65, they were 94% less likely to be hospitalized with COVID than people of the same age who were not vaccinated. So we're seeing in real life, in real time, that the vaccines are working. And we have to be able to share that information also with the patients and communities that we serve as providers. just a few final points on the vaccine and how we can move through conversation and dialogue with patients and communities as they make their decision and as they search for and seek information about the vaccine. It's really helpful to highlight other people who were maybe not sure about the vaccine, but then decided to get the vaccine. Modeling of that is really helpful in really sharing guidance with patients who are still on the fence about this decision. And framing vaccines as an empowering tool rather than as an ultimatum or something that we're forcing them into the corner for is also a really helpful way of thinking about this dialogue, this conversation with patients and framing it. So these are just a few insights that can help us as we think about how we have this conversation, how we activate as clinicians and healers, as we activate ourselves in our work to have this conversation, and how important it is to use language of empowerment and be active listeners as well as a huge part of how we move forward in this next vaccine. Final thoughts before I introduce our clinician and healer panelists who are going to tell us a little bit more about their experiences on the front lines taking care of patients every day and what has worked and what some of the challenges are in having this conversation with patients. I want to emphasize the new opportunity that we now have actually for providers. You can call 877-VAX for NYC, the vaccine appointment hotline, and press 2. That line, by pressing option number 2, is for providers and gives you a more personal way of scheduling appointments for your patients to get vaccinated. I also want to lift up a tool that the health department has just published yesterday on our website. You'll easily find it on our website on the provider page, which gives you a whole list of powerful skills, tactics, and examples of how to have this conversation with patients. And then the 3 call to action points, which I'm going to emphasize a few times throughout our conversation tonight. Number 1, bring up the vaccine at every encounter that you have with patients starting today and every day. Number 2, sharing the commissioner's provider letter that was published on Tuesday morning, which is also easily found on our website at the health department. And then the 3rd is joining the webinar that the health department is hosting tomorrow at 1 o'clock. You can easily register for it on our website at the health department as well if you're a provider. And it's going to be specifically about the Johnson & Johnson unpause, what you need to know about it, as well as it's going to be about how you can have the conversation with patients in a way that is supported and guided and gives you specific language and tactics to use in the conversation. So with that, I would like to introduce our first panelist. Javiera Rivera is currently the Director of Risk Management of Urban Health Plan. She's been Incident Commander and Manager for the COVID-19 pandemic response, and she's currently leading the organization's vaccine efforts. She's a graduate of Bronx Community College, and she has associate degrees in nursing, as well as a bachelor degree in nursing from Chamberlain College of Nursing. She's worked with Urban Health Plan for 17 years because of her commitment to community service and public health. I'd love to pass it over to you, Javiera, to share a little bit about your experiences talking to patients about the vaccine.
Sure. Hi, everyone. How are you? Thank you for having me. Early on in January, Paloma Hernandez, our CEO and my mentor, told me we're getting the vaccine, and we've been counting down those days since the pandemic started, and we were so excited. She was like, do you want to volunteer? I was like, yes. I was excited to leave my house because I was working from home. So I'm like, yes, I'll go vaccinate anyone. So the first day on site, we were able to vaccinate about 36 people. And I was excited, but I was like, it's going to take us forever at this rate. So we started doing outreach. And the key thing that helped us increase within a week to 200 was calling patients and saying, hi, your doctor asked me to call you and offer you this vaccine. And that really changed the amount of patients that wanted to get vaccinated because we said your doctor asked us to reach out to you. And we were able to do anywhere from 200 to 300 vaccines the following week, every day. To date, we've been able to vaccinate first dose 14,000 And we've been able to vaccinate about 47% of that completely vaccinated with their second dose. Right now, we're seeing a plateau and the want for vaccine. That's been one of our challenges. Our number of appointments have significantly decreased. So we're strategizing on how to go to the people, because right now we have to make ourselves available, we have to be flexible, and we have to go where the want is, right? So we're strategizing on how to be more mobile. We've been currently working with the Hunts Point Market. We were able to go this week to one of the companies, Baldor, and vaccinate about 70 people within 2 hours. We're working with other organizations, being as flexible as possible, right? So one company wants us to be there from 3 in the morning to 11 to get the truckers. And although those hours sound crazy, we're willing to do it because our main goal is to vaccinate our community and ensure that everyone's vaccinated. So one of the biggest barriers we're currently facing is that everyone that wanted to get vaccinated is already vaccinated, right? So now we have to convince and work and meet our people where they currently are and reassure them and have honest conversations and educate them and make sure that they feel comfortable and they're able to make an informed decision on whether or not to be vaccinated. So that's really where we are now. We're really strategizing to ensure that we're able to get everyone that we can vaccinated. A personal experience that I had early on was one of the first people I vaccinated. As I'm wiping her arm with alcohol, she starts to cry, and I'm like, oh my God, what happened? So I asked her, I'm like, what's wrong? And she was like, I'm so happy and grateful, and at the same time, I'm sad. And I said, why? And she says, well, because I'm grateful to be able to get vaccinated, but I'm sad that my husband and my son didn't have the same opportunity. She lost both her husband and son to COVID. And I thought that must be such a crazy feeling that she's currently feeling right now. So I consoled her. I got her to speak to a social worker, and that just stood in my head. I'm like, wow, that must be such a crazy feeling that she's feeling. And a few weeks later, I get one patient, and her birthday was April 20th, 1925. And that is actually my grandmother's birthday, who I also lost to COVID. So I had the same feeling that she'd had. I was happy and sad at the same time. And I was sad because my grandmother didn't have the opportunity to get vaccinated, but happy that this elderly lady was here with her mother and her daughter, and she had the opportunity that my grandmother didn't have, and I was able to provide that to her and her family. So I'm very much a strong advocate to getting vaccinated, as I've lost someone in my family that was very close to me, as I'm sure many of us have lost family and friends to something that could be preventable now, right? So I'm all for it. I'm up for waking up at 3 in the morning to go to the point to vaccinate people. And I really ask that as healthcare professionals, we really use every opportunity we have to have honest, open conversations with our patients and reassure them of the safety, right? That the benefits outweigh the risks, that they're concerned about those side effects, and just educate them. 90% of the time, my patients are still scared as they sit in my seat, and I ask them, what are you afraid of? They're afraid of needles. So I educate them on why the needle has to be a certain length and why it has to go in the muscle and the fat and so on. So it's a lot of reassurance, education, and just being able to make them feel comfortable with their decision that they're making.
Thank you so much, Javiera. I'm sorry for your loss of your grandmother, but I'm also so thankful for your service and for everything that you're doing every day to make sure that our communities have access to the vaccine. It's just incredible. So thank you for that.
Thank you for having me. Thank you.
Yeah. Next, I'd like to introduce Dr. Stella Sappho, who is an HIV primary care doctor and assistant professor of medicine at Mount Sinai. She also provides care to LGBTQIA patients at Cal and Lourdes. Over to you, Dr. Sappho.
Thank you so much, Dr. Morse. It is a pleasure to be here with you guys. And I guess the perspective that I'll be offering is being a primary care provider within a health system and what that experience has been like. And so I work at Mount Sinai Health System. I'm an HIV primary care provider. And so our clinic sees primary care patients and quite a few HIV patients. And I also see patients down in Cal and Lord within their urgent care setting. So what has been so interesting, I think, about the vaccine conversations with patients has been the progression. And there's I guess, three themes that really rise up for me that I wanted to share with this group, because I think they really will resonate. And I think one of them is reinforcing what has been mentioned, which is the important role of providers for patients. And so I had quite a few patients. One of my older Latina patients who had been waiting and waiting and waiting for the vaccine, had an opportunity to get the vaccine. She got the hookup from her cousin and actually waited to come and see me to make sure that I agreed with her getting the vaccine. Had another individual who had an opportunity to get the vaccine, but he wanted to wait and come and see me. And both individuals didn't get an earlier appointment to see me. They just waited until they were due for their appointment. And so that was time that was kind of delayed. And it reinforced two things for me. One, how can I be in conversation with these individuals even more proactively so that they're not waiting to see me at a scheduled visit when they have access to the vaccine? And two, just how important it is for so many people to get that kind of approval from their provider, not because they don't trust what's in the news, but because, especially with some of the patients that I'm seeing who have HIV, I see them every 3 months and often much more frequently. And so there's this relationship that we have where they want to make sure, is the vaccine going to affect my other medications? What should I expect in terms of side effects? And so it really kind of has put me in a position of, what are the mechanisms that I have to be really proactive? And there's a couple of steps that, one, depending on how much time you have, that you can consider taking. For older patients, they're not on our My Chart, which is the way that you can talk to patients through Epic. So calling and just checking in, who has a time in primary care to just call, check on your patients. But, they always love it if you call for their birthday, if you call to check in. And having that conversation about the vaccines for some of those patients that you just have the sense maybe waiting for you and who are not necessarily scheduled to come in to see you soon may be important. And so really, really, really want to just emphasize that you may not even realize it, but you're the voice that may be needed for that patient of yours to kind of take the final step to go ahead and get the vaccine. So as much as you can, just think about what you could do to really be able to be in that space with them, to help them to do that before time is out. And time is out being, God forbid they get COVID when we're so close to getting everyone vaccinated. The second kind of thing that really rises to the top for me is the intensity of access as a barrier. And so unfortunately for us at Sinai, we had the situation where some weeks we had vaccines and other weeks we didn't. And what was happening with patients, and I worked in the vaccine clinic, volunteered in the vaccine sites in the early weeks. And what was happening for patients is that they would walk by the vaccine distribution sites to come and see me in clinic, and they would say, well, I tried to get a vaccine with you guys at Sinai, and you didn't have any appointments available. And I feel like, Sinai is selecting certain patients to get the vaccine first, which is not true. It was just, we reached out and got who we could get at the time. And the thing that I think it ended up doing was, unfortunately, many of my patients are Black and brown patients. I think it unfortunately reinforced some of these ideas that some patients have, that the healthcare system isn't for them. That, if COVID is so much a problem for us and the vaccine is here, why can't I get an appointment through my doctor and my health system? The good and amazing news is, and it's because of the Department of Health and it's because of the amazing folks at Sinai that are really doing the work, we now have a lot of vaccines. So what happens when patients come in and they say, I wasn't sure about taking the vaccine, but I'm thinking about it, and I'm able to have a conversation with them and get them there, I no longer have to do the thing where I'm like, well, call that number and let's see if we can get you an appointment. I can actually walk them over and get them an appointment on site. And it has made a tremendous difference, the number of folks that are getting appointments for vaccines more immediately. So it just, I think Dr. Morse may have said earlier, the extreme importance of access. Access is everything. It doesn't matter if I convince a patient who's, has vaccine questions, if I get them to a place of saying yes to a vaccine, if I still now have to struggle to get them access. And the more immediate access we can get, the better it is. I think the final thing that I will say is that I have encountered patients who were really interested in a specific vaccine. And so patients will come in and say, I want to get the Pfizer vaccine, doc. That's the one that I want. I had a couple of patients before the pause who were really interested in the J&J vaccine because they thought it would just be easier overall. And for those patients, there's just conversations that we have about the importance of, taking the vaccine that you can get, and the importance of just getting protection as soon as you can get it. But I have definitely experienced that. And it has led me to a place where I have found that the excellent and amazing resources that we have from the CDC and the Department of Health, it has been helpful for my clinic patients to just distill it down into like a simple one-pager that I can kind of give them and talk them through about the different vaccines and why it's important. And so I encourage you guys to translate all of the amazing resources into language that you know your patients will get, and to just take the time to walk them through. I have patients who have 20 medications, 7 medical problems, and I have 20 minutes to see them. The time is never enough, but I will say that I've been pretty successful in getting these vaccine conversations in a way that is seamless while I'm checking their blood pressure, while we're moving through the visit. And so, just that it's very feasible to do it, and the effects have been super, super helpful. And so just, hoping that my colleagues out there are also able to do the same. Pass it back to you.
Thank you so much, Dr. Sappho. I feel motivated to have the conversation. It was really, really just incredibly helpful. And again, to all the providers, clinicians, healers who are listening, we thank you for finding the time to join this conversation, and we hope that it's helpful in inspiring you to have the conversation with your patients at every opportunity that you can and every space that you can. Next up, we have Marcella Flood-Brown. Thank you for being with us. Marcella is a psychiatric nurse practitioner, and she's also the Vice President of New York City Operations for Sun River Health. So Marcella, please share some of your experiences with us.
Good evening, everyone. I'm so happy to be here. This is a very important topic that, I encounter on a daily basis with my patients. On every encounter, I try to talk to them to make sure that they're getting vaccinated, ask them what are their concerns, and how can I help them. Here at Sun River, we've actually reached 90,000 vaccines given to our population, which is the homeless, the farm workers, the migrant workers, and anyone that's underserved. And most of those vaccines went to those populations. I remember a situation where my patient came in and she said, listen, I want the vaccine, but my family is totally against it. They're telling me I'm going to grow 3 heads. I'm going to, be one of those Tuskegee airmen who, were in the study and they started dying and things like that. So after we talked about all of her concerns and, I re-educated her, she said, okay, I'm going to get the vaccine. Lucky for us, we have a lot of access. I walked her over and I said, okay, let's go. So we went over, she got her first vaccine, of course, with me holding her hands, but she was very happy to get that vaccine. Now, when she came back for her second dose, again, she's like, come on, come with me. I'm like, okay, let's go. And she got her second one. And she was ecstatic to get it because she had minimal side effects. It wasn't what she at all expected. And she was, very happy because she worked in a hospital setting. I think, a lot of the outreach strategies have to happen. Here at Sun River, we have a lot of outreach strategies that we use to try to get people vaccinated. We go out into the community, to our shelters, to our churches, and try to educate the staff and the clients that they have there to come get vaccinated. We try to hold focus groups. We do data reviews. We even send out a vaccine survey for hesitant patients to see where they are and where we can help educate you to try to figure out what's stopping you from getting that vaccine. We have video testimonials on our websites. I got my shot, and why did you get that shot? For whatever reason, my parent died from COVID, different reasons, but it helps people to make that decision to get the vaccines. We've even gone to trying to employ mobile units to go to different facilities to try to convince people to get the vaccine. I think, having it on our social media pages, on our TVs in our health centers, and just on our website, I think at every touch point, we have to make sure that people just recognize that the vaccine is out there and that they need to get it. And, you know, and just addressing any concerns. You know, we train our nurses and our providers just to answer any questions that this patient has. So be very concerned about what are your issues, what's your problems, you know, what do you think about it, and just, you know, getting rid of some of those myths and kind of little scenarios that people put out there to say why they can't get the vaccine. And I think that's, you know, very important. And, you know, just having the providers be able to talk to their patients, because they really do trust us. You know, they rely on us for a lot of things. And as a psych provider, I think, you know, just getting into some of those emotional concerns and trying to figure out what's going on with them really helps. So.
Thank you so much, Marcella. I especially appreciate your comments about accompaniment. That so much of our profession is walking hand in hand with our patients, with community members, and doing whatever it takes. That is what we're called to do in this moment and every day. And it's just really, again, inspiring to hear how you have shown up in that way for your community and at Sun River. So thank you again, Javiera, Dr. Sappho, Marcella, for your incredible service and for coaching us, for being prepared to have this conversation and walking through some of the common things you're seeing as you have these conversations with your patients and with your communities. And now we have a few minutes for some Q&A. So really, again, just want to lift up huge thanks to all the providers, clinicians, and healers who are tuning in right now, who are watching this conversation, who are thinking about how to have the conversation with their patients about the vaccine. It's really just encouraging, again, to know that we can together do this. We can lift each other up and support each other as providers, as healers, as clinicians, as we move into this next phase of the campaign for vaccination and moving our way through and emerging from this pandemic. So thanks to everyone who's listening. I also want to give a special shout out to many of the chief nursing officers, chief medical officers, and other clinical leaders that we invited to join this conversation today, and who have shared the information about the conversation in this roundtable with all of their teams, partners, colleagues, etc. We really, again, are encouraging each and every one of you to share this conversation so that we can continue to push forward with the vaccination campaign. I know that Deputy Mayor Hartzog is going to have to step off in just a few moments, and just want to thank her for her support and leadership again through this time of crisis. I know as a physician myself, it's just so encouraging and affirming to know that we have you in leadership pushing for everything that we need as providers to be able to be successful. So thank you for all of your hard work, and thanks for being with us this afternoon.
Again, thank you for having me. And I think, and I'm sorry that I have to hop, but if there's anything that we can do to better support all of you in your work, I'm here to learn from you and make sure that we're able to respond rapidly, and appreciate everything that everyone's doing and all the work that's happening. So thank you. Thank you so much.
Thank you. Okay, I'd like to put forward this first question. Commissioner, you can answer the questions too if you want, but I'm looking especially to Javiera, Marcella, and Dr. Sappho. So thank you to all of you who submitted questions online. And I know that many of you, again, are providers. Sometimes we as providers also feel alone in trying to do difficult things, like have difficult conversations about the vaccine. So again, thanks to all of you who submitted questions ahead of this roundtable. Here's the first question I'm going to put forward, and free for all, whoever wants to jump in. Do you have any suggestions for convincing frontline staff with significant vaccine hesitance to get vaccinated? And the person who submitted the question says, we've provided education sessions and information, candid roundtable discussions, time off to obtain the vaccine, on-site events, raffles for those who were vaccinated, and conversations with champions who took the vaccine. We've only had marginal success convincing staff to take the vaccine. So this is a really tough one, a really common one. Opening it up to all of you for your suggestions and your guidance.
I'm happy to jump in on this one. So one of the things, first of all, that question sounds like so much excellent work has been done at that site, which is really commendable. And one of the things that I often run into is that people who maybe, especially staff who know the science and understand and all of that, who may be taking their time to get the vaccine, are doing so because they really do want the time, right? So the vaccine came out in December. It is now, when is it even? Who even knows? Time has no meaning these days. It is now the end of April, right? And so if you think about it, you know, we've had less than 6 months of this new thing being out there. There are some people who have just said in their minds, I'm not doing this thing until it's been 6 months or 9 months. And so one thing that I will say is that for those people, there's just a time running thing that has to happen. And it is almost helpful to just be able to support them in continuing to offer the examples of, you know, this person got the vaccine and they're safe, and just kind of the testimonial work that it sounds like you're doing. That's one group that I've really encountered. The other thing that I would offer in a lot of the conversations that we're having is sometimes within a health system, if the very staff and leadership that wants you to get vaccinated are also the ones telling you why you should get vaccinated, there's a little bit, not exactly a conflict of interest, but sometimes your staff may feel like, well, of course you can tell me that it's okay because you want me to get vaccinated. And I have found, or we have found, that when outside speakers are brought in, that sometimes that can be the thing that helps to move it. One of the spaces that I'm now kind of designing into a bit more is me as a Harvard-trained doctor, right? I may not speak and connect with people in the way that I think is appropriate. So one of our medical assistants is amazing. She started off super vaccine hesitant, refused, and would sit in our kind of central area and be like, I'm not getting the vaccine, never, no way. She educated herself, she got the vaccine, and now she is an incredible person to speak with to get the vaccine. And what I want to do is I want to bring her with me in these conversations because she can connect in a way that probably even I can't, right? And so I would just offer to that question of give it some time because some people are just going to be waiting, and also consider what it looks like to bring someone from the outside who doesn't seem to have the same maybe power structure that you may have as a leader within that organization, and that may also help to move it forward.
And just to piggyback on Dr. Sappho, I think that having other staff who were vaccinated come along and say, hey, I got vaccinated for this reason, and hey, I'm okay. And I think those testimonials are so important because it helps people to realize, hey, it wasn't so bad. You know, those symptoms didn't exist, you know, and if they did, they were minimal and the person is still here. So those things absolutely make a big difference.
Beautiful. Beautiful. Thank you for those comments. And again, that's a very difficult question. Really very much appreciate the person that submitted it. And again, as Dr. Sappho said, you're doing great work, and yet we have to keep pushing. So thank you for that. I actually wanted to pose the next question to Marcella specifically, particularly because you are a behavioral health provider. And sometimes I think we think that, you know, vaccination conversations should only happen if you're a primary care doctor, or if you're a nurse in a primary care clinic, or if you're kind of in, you know, internal medicine or pediatrics. And sometimes, especially because our profession is so broad, right? We all have such different roles, and we have so many professions that are a part of the healing professions. It can be easy, right, to think as providers, oh, you know, that's for the internists or that's for the primary care doctors. I'm wondering if you can talk a little bit about what you think is important in terms of the role of behavioral health providers in having the vaccine conversation.
I think it's important because we touch on a different aspect of the person. So we're in touch with their emotions. We're seeing what's going on. I mean, I believe in holistic care. So when I'm talking to the person, I'm looking at everything. If they're one of our patients for primary care, I look at their labs and, you know, I say, hey, I see that your blood pressure is always high. I see that, you know, you're not taking your diabetic medication. I think we have to touch on it all. And if I have a good rapport with the person, that means that they're actually listening to me. So now they go to their doctor. They're getting that, you know, extra. Maybe, you know, I help them to take their medication. We strategize maybe good things to do to get your health in order. And getting vaccinated is one of those things, you know, if they have a lot of comorbid issues, you know, vaccination will help them to at least not, you know, end up in the hospital. And that's the ultimate goal. We want to keep them healthy. And to do that, you know, you have to touch on everything, you know, and while they're speaking with me and they have, you know, their emotions are high, things like that, I think, it's a good time to say, hey, what about that vaccine? What about this? What about that? And just addressing a lot of those concerns. And, we have a little bit more time as mental health providers to kind of touch on the emotional issues. When you're primary care, you're dealing with all of the chronic illnesses, but you're not so much touching on those emotional things and those concerns. And I think we have a lot of time to do that as behavioral health providers. So, it's a good time to do it.
Thank you so much for that. I'm going to pose one more question, and then I'm going to ask each of you to kind of share a closing comment or a closing recommendation. I'm going to call it a recommendation. The last question I want to ask you all is, do you and have you been saying, I'm vaccinated and I think you should get vaccinated? The reason I ask this question is because sometimes it can feel a little personal or sometimes even uncomfortable to say what your vaccination status might be. And I'm just curious about what you think, again, as providers, as clinicians, as healers. How do you feel about disclosing your vaccination status as part of the conversation with patients who have concerns about the vaccine?
I'm pretty open about it. Usually what happens is I feel like as a mental health provider, I have to give a little to get a lot from you. So I have to give you something in order for you to give me something. So I am open about it because then it, fosters good dialogue about why you should do it.
So at Urban Health Plan, the associates actually wear pins that say I'm vaccinated. So our patients know who's vaccinated or not. And I think that makes them feel more comfortable. They ask us, they're like, so are you vaccinated? And we're like, yes, of course we're vaccinated. So I think that it encourages them. So I think it's good for them to know.
I think it's a great question. For those who may not feel comfortable, it's definitely worth finding out if other folks in your clinic may be comfortable sharing their story. I have the kind of patient interactions where patients definitely are always asking about my business, and they definitely asked about the vaccine, whether I got the vaccine early. They wanted to know which one I got. They wanted to know what the side effects were, and it was helpful to be able to share my story. One of them wanted to see the picture that I took after I got my vaccine. And so I think if you're able to be open in this space, it definitely is helpful. But if you're not, having a colleague or another trusted person, like one of your medical assistants, LPNs, front desk person, social worker that would share, I think could definitely help.
And I'll just jump in. Our colleagues' answers were spot on. I have to show. I'm wearing my pin right now for the camera, so you can see that I wear it on my on my sleeve, as it were. But the reflection that I wanted to offer as well is that I feel like this is one of the ways that I have grown as a doctor and as a clinician in my practice. I remember early on when I was taking care of patients. I didn't share very much about myself at all, in part because it felt like it was too, egocentric, too focused on myself, and it's supposed to be about the patient. Why would I take up any time in this precious, 20-minute encounter talking about myself? And as the years have gone by, I've just seen how important it is to share that vulnerability and use it as a space for opening a different conversation, as all of you have alluded to. And so of course it's always a personal decision, an individual one, but certainly for me, it's something that has opened up a different realm of the conversation, and often a particularly beautiful shared vulnerability between the patient and the clinician.
Thank you for that. Thank you for those comments to all of you. And so this is our chance to have kind of just a final recommendation. I'm going to go in order as what we started with the panelists. So I'll ask Javiera, to start, and then Dr. Sappho, and then Marcella, and then Commissioner, you'll get the chance to make the final recommendation in this round. And then I'll just share some closing remarks. What I'd like for each of you to just share a final recommendation on is for providers who are struggling to have this conversation. And I know that that is many of us. Can you just share kind of one final kind of inspiring or activating suggestion or recommendation for other clinicians and healers to get them amped up to have this conversation? Just kind of one final suggestion.
I mean, I think ultimately we just have to be honest and empathetic with our patients. I think that goes a long way, and I think they would respect it. And as long as we meet them where they are and respect their wishes at the moment, I think that would mean a lot to them.
And I would add to that, the patients in my clinic have been through so much. They've been through HIV and, substance use and all kinds of things. And COVID is just the latest thing that is challenging our population. And so many of them have been waiting to get the vaccine. And we lost someone last month who was waiting to get vaccinated and ended up getting COVID before she could. And we all mourned it because she had isolated and been, in the house and just been waiting, and her time ran out. And I will say that inspires me to just remember to check in with every single patient. I know that things with discussing, vaccine acceptance can sometimes get political. It's just the world that we live in. It's insane that wearing a mask can be political, but such is life. But I keep patients like that patient in mind whenever it feels like it could be difficult or it could take time away from the other 4 things that I have to do. The urgency of it has not at all gone away. COVID is still a huge threat. And I think starting your clinical sessions with that understanding will allow you to be patient when people are asking the questions or seeming reluctant or being dismissive, because I think that our voice, we're very lucky that this is the case. I think our voice does carry a lot of weight with our patients. And if it doesn't work this time, there's always the next time you see them and the next time and the next time. So I think the urgency of it, the ability to practice patience and to approach this with the thing that I think many healers do, which is empathy and compassion.
And just piggybacking on that, it's very important that we are compassionate for our patients and respecting their right to say no. People have a right to say no. And, all I do is just keep, educating on, continuously and trying to get them at every touch point, do you have a vaccine? Do you want a vaccine? I know you said no last time, but how can we help you, change your mind? And respecting the fact of what do you want to do and how can I help you get there? So I think that's very important for every provider, and just taking that time to listen to them, I think is very important. Like Dr. Sappho said, not being dismissive, just taking that time just to sit back and listen to what they want to do and how can I help you get there?
And, my suggestion really flows from yours, Marcella, and it arcs back to what I tried to say at the beginning about humility. And, I think we've covered a lot of ground with respect to what we can do as clinicians, as healers, as practitioners. My suggestion is for us to not forget that we can also take a step back in many situations and let the patients that you have succeeded with, who have gotten vaccinated, and encourage them to share their stories. For so many of them, and I know all of you have borne witness to this as well, it is such a joyful thing. You heard about some of the ways in which it has brought tears of joy. And I think part of our task is to encourage that feeling, that reflection to spread so that it's not just us, although of course it starts with us, but it's actually patients themselves who are speaking with one another, whether it's with a neighbor or a family member or a member of your church or temple or synagogue. But we can nudge it in the right direction, to have that sharing happen.
Thank you so much, Commissioner. Thank you so much, Marcella. Thank you, Dr. Sappho. Thank you, Javiera. Thank you for being with us. Thank you for these incredible words. Thank you for your service. And we know better than anybody. Some of the days are long. Some of the days are really long. But I'm just honored to get to be in this battle with all of you against the pandemic. And I want to just close this out with kind of a final call to action. We're going to be repeating this call to action over and over again, hopefully so much so that you're sick of it or have it memorized or both. But really just, again, appreciate all the providers, clinicians, healers that have joined the conversation this evening. Really, again, also appreciate the clinical leaders, the chief nursing officers, the chief medical officers that we reached out to tell you about this event, to get you to tell your teams about this event. And we're going to do lots more of these kinds of conversations. Again, just helping to support each other and activate each other to have this conversation. So just a final reminder, you can actually call 877-VAX for NYC and press 2 when you're a provider to help schedule your patients for appointments, to add that personal touch of my provider, wanted me to get vaccinated. It's huge, it's helpful, it helps to increase access. I want to remind you of the 3 pieces of our call to action for today and going forward. Number 1, bring up the vaccine at every encounter that you have with patients and community starting today and every day going forward indefinitely. Please bring it up at every chance that you get. And sometimes that's with, your colleagues who are also clinicians and healers. But for the most part, that's going to be with patients and community. So please continue to bring it up. Number 2, please share the commissioner's letter to providers that was sent out on Tuesday. It is a real call to action. We need you to help us get through this next phase of the vaccine campaign. And the commissioner's letter can be found very easily on the health department's website. So please share it. And then finally, we are doing a webinar. The health department is doing a webinar tomorrow at 1 o'clock. We're going to be talking about both the Johnson & Johnson vaccine and updates on it, as well as, again, more opportunities to learn how to have the conversation with patients about the vaccine. So that's our call to action. We look forward to working with you to keep growing this call to action, to keep engaging you, and continue to keep supporting you as well as providers, clinicians, and healers in the hard work that we have ahead. Thank you for everything you've done to date, and we look forward to seeing you on our future webinars and conversations. And thank you again to the panelists. We so appreciate you, and we've learned so much from you. Be well, everyone.